Good morning, everyone. Just before we start, the purpose of our meeting today is really for me to give you some information, things that we know about the COVID vaccines that we have available to help you think through the decision about getting the vaccine. But before we start, I really want to say something to all of you, which is that, we know that this is a really tough time for everybody in your field. Specifically in your field, it is a very challenging time for a number of reasons. We've had so many outbreaks in long-term care homes and retirement homes. We've had several people who haven't made it through those outbreaks, and each one of those is very tragic, right? And all of you people are absolutely doing your best. And I know that you are there every day trying to look after your residents and trying to look after each other and trying to do it as safely and as efficiently and as care, with as much care as you can muster, given that everybody also has their own things going on in their own families. And this pandemic has just put stress on every single place, every single piece of our lives. So just before we start talking about vaccines, I just really want to express how much I appreciate all of the work that you're doing and everything that you do every day just to do your best, right? That's what we can do in these situations. And I want to say thank you and that we really appreciate it. And that all of our teams here are here to do whatever we can to support you, but recognizing that what you're doing, being, on the ground, giving care to people who are very vulnerable to COVID, is a very special thing. It is an important responsibility. We take that seriously that you have that, and we want to make sure that we support you however we can. So thank you. There will be, there's no way that this presentation can answer all of the questions that you would have about vaccines, right? So you can always give us a call and ask some of the questions or send those questions to the contact point that you have in your organization who could send them to us, because if you have that question, it's probably you're not the only one, right? But we sent out a survey asking all of you, what are the questions that you have about COVID vaccines? And we got about 500 responses, so that was just excellent. And we took those responses and kind of grouped them into categories to give you answers, right, about the things that you might want to know about, recognizing that we couldn't possibly handle 500 questions in this hour, but we can handle the ones that came up the most often, right? So that's what we'll try to do. Okay, so here's what we're going to talk about today, right? We're going to talk about, in general, how vaccines work. We're going to talk specifically about the Pfizer and Moderna vaccines, which are the ones that have been made available and approved by Health Canada. We're going to talk about safety and effectiveness of those vaccines, things that we still don't know about with those vaccines, right, because they're new. What the rollout plan for vaccines is in Lambton, so far as we know right now, or that we can talk about, and then any extras, additional things that we want you to keep in mind as you think through your decision making around getting a COVID vaccine. So, in principle, now I recognize a lot of you are going to know this, but I don't know what people know and what they don't here, so I'm starting from the very beginning, right? This is how most vaccines work. They introduce your body to a non-harmful or less harmful version of a bacteria or a virus, and then they let your body's own immune system recognize and fight the less harmful version, so that if you get exposed to the real thing, your body is better prepared to protect you. That's how most vaccines work. Pfizer and Moderna vaccines work a little bit differently than other vaccines. So we need to talk about that because it's important that you know. They still do the same thing. That is, they introduce your body to a non-harmful version of the disease so that your body can recognize it and build protection against it if it's exposed to the real thing. But they do it in a bit of a different way than most vaccines do. In order to understand how the vaccine works, you need to understand a little bit about how the virus works. COVID-19 is a virus that is part of a family of viruses called coronaviruses. Coronaviruses are responsible for a number of things, ranging from the common cold to SARS and MERS and now COVID-19, right? So coronaviruses are a family of virus, and this one specific virus in that family causes COVID-19. those viruses, this coronavirus has little proteins on it when you look at it under a microscope, and they look like little spikes. So we've called them spike proteins because scientists are not particularly creative sometimes. So the spike protein is what helps the virus to attach to your cells and cause infection in you. Most vaccines would take that virus, kill it, put it into, break it up into parts, put those parts into a vaccine, give that vaccine to you, so you're getting sort of a killed or weakened version of the virus, and then your body builds up immunity to it by recognizing those components and fighting against them by building antibodies, right? So that's what most vaccines would do. What the Pfizer and Moderna vaccines do is actually contain the instructions for your body to make the spike protein. So your body is going to make the spike protein that otherwise you would have been exposed to with the virus. The protein moves out of your cells and your body's immune system recognizes, wait, that's not a part of my body, I need to fight it. And it starts making antibodies to fight the spike protein. Remember, the vaccine does not have the instructions for the whole virus. It only has the instructions for the spike protein, which is the part that your body first sees when it attaches to your cells. So if you later get infected with COVID-19, your body would remember that it has seen that spike protein and build antibodies quickly to fight the infection before it gets very severe. So the next question is, how do we know that that vaccine works? And in order to know how that vaccine works, you have to know how we study vaccines. So the high-level summary of how we study vaccines is you take one group and you call it a control group. It should be a large group of people. With that group, you do nothing, or almost nothing, right? And you follow them over time to see if any of them get the disease that you're looking for. Then you take a trial group, which is also a large group of people. And you want that group to be as close to the control group as possible in a lot of its other characteristics, how old people are, all of the other kinds of characteristics that we use to break down groups of people. And you give them the vaccine and you follow them over time as well to see how many of those people got vaccine. And then what you do is at the end, at a certain point, you compare how many people in each group got the disease, how many people had side effects, and that way you can calculate how effective the vaccine is at changing the outcomes between the two groups. So let's talk about the two vaccines, right? The Pfizer trial took 18,000 people in each group, control group and trial group. That is a lot of people. In the control group, just under half of them, 46%, had one or more chronic diseases like asthma, obesity, lung disease, diabetes, high blood pressure. So typically when you study things, medicines and things like that, you try to find populations that don't have anything else going on. Like they're generally healthy, they don't have other medications. But this population of the control and the trial had people who would be like the people that we are going to vaccinate, people with chronic diseases, people who are on medications, people who have other conditions that are not that may interfere with what happens in the trial, right? In the trial group, you had 18,000 people too, and 46% of those had one or more chronic diseases, and importantly, a fifth of them were over 65. So when you compared outcomes between the two groups, there were 162 cases of COVID-19 in the control group and 8 cases in the trial group. So the researchers calculated that the vaccine was about 95% effective at preventing symptomatic COVID-19 disease. That is very, very important, and we're going to get into why later. With the Moderna trial, they had 14,000 people in each group, which is still a really big number of people. It's a lot of people. It's a good number for a study. In the control group, 22% had one or more chronic conditions, and they called, lung disease, heart disease, obesity, diabetes, liver disease, including people with HIV. In the trial group, they had about the same amount of people who had chronic conditions, and a quarter of them were over 65. So that's important too. Generally, in a lot of studies about medication, we leave out that group. And then when it comes time to apply the medication to that group, we go, well, we don't really have evidence. So it was very important that people over 65 were included in these trials so we can say something about how safe and effective it is in those groups of people. With the Moderna trial, there were 185 COVID cases in the control group where they did nothing, and 11 cases in the trial group. And these are people who are just going about their lives, right? So they're just doing things that people do, and we see who gets disease and who doesn't. So in this case, the researchers calculated that the vaccine was about 94% effective at preventing symptomatic COVID-19 disease. Okay, so one of the biggest questions that we were asked was, what's the difference between Pfizer and Moderna, right? And I think the important thing to remember is it's really not a competition. Both of the vaccines are really good at preventing COVID-19 symptoms. The difference between 94 and 95% effectiveness is really minimal when you push it out into a population level. It's really, you should consider them to be basically the same in terms of their effectiveness. They are both 2-dose vaccines, but the amount of the dose and the schedule of the doses are a little bit different between the vaccines, and that's because of how the studies were designed. The Pfizer vaccine needs to be stored in an ultra-low temperature freezer, but it's stable in a refrigerator for up to 5 days as long as it isn't opened. And we heard some concerns earlier around being able to move the vaccine, and Pfizer has given everyone some instructions on how to do that safely. But in principle, you really don't want to move it around too much. So once you send it to the point of distribution, you take it out to the places where you're going to deliver it, and you try not to move it too much back and forth between delivery sites and places like that, right? The Moderna vaccine is stored in a low temperature freezer, which is about -20 degrees Celsius, and it's stable for longer in the refrigerator, about up to 30 days. Oh, I see a little typo there, I missed a bracket. But as long as you don't open it, right? So we think Moderna can stay in a fridge for about 30 days, Pfizer can stay in a fridge for about 5, as long as neither of them are open. So you can see immediately how Moderna might be a little bit better for widespread distribution, right? Because of the freezer requirements, and also because it's stable in the fridge for longer. But remember, even if we might normally, under normal conditions, when we give you flu vaccine, for example, we might send the flu vaccine to you and you do it, some of the considerations around here are around minimizing wastage of any of those vaccines, ensuring that there's proper temperature control and monitoring around the vaccines if you were to keep them. So we're looking at delivery methods and options that would really say we're going to bring the vaccine to you, immunize as many people as we can, and not really leave any vaccine on site for the first little while as we get more experience with this, and as the focus is on really minimizing wastage. Okay, it's important if you're going to get a vaccine that you know what the potential side effects are, right? And these are the kinds of side effects that they look for in the trials. They categorize them by local reactions and systemic or whole body reactions. So they look for, in local reactions, is there redness, is there swelling, is there pain at the injection site, right? And those are things that you can get with any immunization, and those are things that they looked for in these trials. And then the systemic ones, they look for, things that affect your whole body. Do you have a fever? Do you have whole body fatigue, headache, chills, vomiting, diarrhea? Do you have muscle and joint pain? Those are the things that they look for, and this is what they found. With Pfizer, the mild side effects really do depend on the age that you are when you get the vaccine and the dose number that you're getting. But by and large, we found that the mild side effects were about 35 to 60% of people get fatigue. And you're going to say, why is that range so big? Why is it 35 to 60%? It's because of the way that they categorize the data. So there were some numbers for fatigue based on age category and some for dose category. So I'm giving you the whole range, right? Headache was present in about 25 to 52% of people, muscle and joint pain 11 to 30%. So, but these are mild side effects because they don't happen for very long and they're not very severe. So when people rated these side effects, they said this doesn't interfere with my function, right? So when you ask people, they're maintaining a little diary after they've gotten vaccinated and they say, oh, I'm tired. And then someone calls them back and goes, how tired were you? Was it the kind of tired where you can't get out of bed and do anything? Oh, no, it was just, I felt a little bit sluggish, like maybe I was coming down with something, a little tired. So it's those kinds of things that we think are mild side effects. Severe side effects are the ones that we think, generally you categorize them as things that interfere with function or that things that require additional care. So for example, you could say, oh, I was so tired, I just couldn't move all day. And that would interfere with your function. That would be listed as severe. Or I had an allergic reaction and I needed to go to the hospital. That would be severe. It would not only interfere with your function, but require escalating treatment to deal with the symptom, right? So that's about 0 to 3%. And that's pretty good for severe side effects, right? When we're talking about severe side effects, we're talking about even including things like I was at home because I had a fever for a day. I was very tired and couldn't, I had a headache that prevented me from functioning during the day. So it includes a wide range. The important thing you need to see, though, is the severe fatigue one. That was about 5% for dose 2 in people 18 to 55, right? So not as low as the other ones. It's important to remember that may happen. It doesn't last for very long, but it's severe enough for people to note that. So there were no vaccine-related deaths. That's very important. Severe side effects were very rare. The side effects, though, with the vaccine were a bit more common after the second dose. So if you get your first dose and you're fine, that's great. If you get your second dose, there, at the population level, we think there's a bit more prevalence of side effects with the second dose. And side effects were actually more common for people under 55 than over 55 in Pfizer. And here's why. That makes perfect sense, actually, from a medical point of view, because what you're doing when you get in a vaccine is mounting an immune response. What kinds of things happen to you when you're mounting an immune response? You get tired, you get a headache, you might get some muscle pain, right? So these are the things that essentially tell us that it's working. And we also, it's possible that people who are older don't mount as much of an immune response and therefore they don't have the side effects. We don't really know, but we do think it's just as protective in those people, even if we don't see a major, a side effect profile in them. So the common side effects that are more than 1 in 10 people, right? Injection site pain, which is, I think, something you would expect, just as with any vaccine, and some tiredness, headache, and muscle pain, right? So you're going to get a little bit of that, and you have to think, why is that? It's because my body says that there's something going on that's different, and it's pretending that you have a disease and reacting to it, right? In order to build antibodies. So Moderna, I'm going to try to cover this too, right? Again, mild side effects depend on the age and the dose number. Fatigue, headache, and muscle joint pain, kind of the same range that you saw in the Pfizer, so no big difference there. And again, the severe side effects are about 0 to 3%, except for severe fatigue, which unusually was more prevalent in people over 65 with dose 2. These are just some of the things that you find out when you get these studies, and it's hard to say how important they are. It's just that they want people to know, and I want you to know. But I don't think that I think you need more experience to say for sure that these things are valid when we start immunizing the large like everyone in the population. And 10% with the Moderna vaccine of people under 65 reported some severe muscle pain. It doesn't seem to last very long, but again, it's this sort of idea of, what does your body feel like when you're about to get a flu or a cold, and when you're probably a flu, and you're responding to that, right? You just don't feel that well. And because the vaccine is giving you a less harmful taste of what that real disease would be like, you're going to respond in a very similar way to as if you had a mild version of disease, right? No vaccine-related deaths. Severe side effects were very rare, but again, more common for the second dose than the first, and we don't really know why that is. More common for people under 65 than over 65, and again, we think that's because of a more robust immune response. Same kind of common side effects: injection site pain, some tiredness, headaches, and muscle pains. So things that you can expect to have, but that don't last very long and don't impact your function for the most part. Okay, this is a very, very important thing that you need to know. Even people who were given an injection without vaccine had side effects, right? So when you do these trials, you have a control group and a trial group. You give the trial group the vaccine, but you can't give the control group nothing because they'll know that they have not been immunized. So what you do is you give them a saline solution, something that's harmless, or in some trials you give them a different kind of vaccine that works and is safe and has but in this case it was saline, right? So you're giving people saline, and even those people had side effects just from the injection itself, right? So close to 30% of people in the Moderna placebo group, that means they got an injection that had no vaccine in it, who were in the age group of 18 to 64 reported fatigue and headache after the first dose, right? So there's a certain amount of sort of, oh, I got something, I think it might be the vaccine, oh, I was tired that day. And so that's 30% of people, right? So teasing out which of the side effects is related to the vaccine and which of the side effects is related to what you think might happen because you got a vaccine is very hard. And 38% of people in the Pfizer placebo group over 56 reported any systemic events, so fever, chills, etc., right? And it's really hard. You know that they got nothing, so you can't say that it was the vaccine, but we know how powerful our mind is around these things. We know how powerful the idea that maybe you got a vaccine and maybe there's something going on with you is. So just remember, right? Some of the side effects are related to what people feel when they get the vaccine, and some of the side effects are related to the immune response that comes from the body reacting to the vaccine itself. So who can get this vaccine? Right now, Pfizer is approved for use by Health Canada in anyone over 16 and over, sorry. And Moderna is approved for use in anyone 18 and over. And that's really because of who was included in the study populations that that resulted in data for Health Canada to analyze. And it's approved for anyone without a known hypersensitivity to any of the ingredients. Now, these vaccines don't have the kinds of ingredients to which people might sometimes think that they have hypersensitivity to. So there's no egg protein in it, there's no latex, there's no, but the one thing that is important is that there is a thing called polyethylene glycol in it, which is a substance that sometimes people use for preparation before bowel procedures and things like that. And so if somebody's had a very severe reaction to that procedure, maybe because of that PEG, polyethylene glycol, that would also be a person who shouldn't get the vaccine. There are no other serious warnings or precautions, okay? And there's a question about contraindications, so I'm going to talk about that in a second. The province is going to decide which groups are eligible for vaccine at which time, right? They have a schedule, but of course that schedule is going to keep changing. So keep your eye on it, and we'll keep our eyes on it too. The current priority as of January 6th is long-term care and retirement home residents and staff, and that has also been expanded to include the designated essential caregivers. If they are designated, then they're also eligible to receive vaccine. And ultimately, right, it all comes down to how much we have. So the provincial and local vaccine supply and delivery schedules are really going to be the drivers of who gets vaccine and when. And that situation changes daily. And oftentimes, just so that you know, the media can report on these things sometimes before we do, because they'll get that briefing from the province or whatever and then come out with it. And sometimes we're playing catch up. Oh, I heard that this group is in now, and what do we do about that? So are there any contraindications for the senior population? So not really. Whenever we think about a vaccine, there are two kinds of contraindications: absolute contraindications, which is absolutely no, you cannot get it, and a relative contraindication, which is, ooh, maybe there's something here that you should think about and either get it later or get it in a specific way. So, and I will talk about that as well, because those are some of the questions that you had. So we'll be talking about that in a second. Okay, so here are the special considerations, right? The absolute contraindications are you cannot use the vaccine for people for whom it has not been licensed. Okay, so if you're outside of the age bracket for whom the vaccine has been licensed, then you are also outside of the provincial eligibility process, so you cannot receive the vaccine. If you are hypersensitive or have a known allergy to one of the components of the vaccine, you cannot receive the vaccine. So now let's go to some other special considerations, relative contraindications, okay? If you have an acute illness that day, the consensus from people who do vaccines all the time is you shouldn't get a vaccine that day. It doesn't mean it's going to hurt you, but the guidance is really that you should delay immunization until you're feeling better. And there are two reasons for that. One is that if you have an acute illness, sometimes if you also get a vaccine, it becomes hard to tease out what are the symptoms that are happening to you because you're ill, and what are the symptoms that are happening to you because you just got a vaccine. And especially where you want to be able to monitor and treat people who are ill, you want to know that the things that are happening to them are related to the illness and not to the vaccine. That's the first piece. The second piece is that if your body is already responding to an illness, we want to make sure that your body is almost reserving as much capacity as it can to respond to the vaccine. So that's the other piece to that too, is why you want to delay immunization in anyone who's acutely ill. If you have a bleeding disorder that is stable, if you have a bleeding disorder that is unstable, you definitely need to have a consultation with your healthcare provider before you think about vaccines. If you have a bleeding disorder that's stable, so for example, if you're on long-term anticoagulation, blood thinners, things like that, and it's stable, you can definitely get the vaccine. The guidance is really you just apply pressure for 5 minutes over the injection site. Don't rub it. Just keep pressure and give your body time to clot adequately if it needs to around the injection. If you have a history of anaphylaxis, you may need a controlled setting. And what I mean by anaphylaxis is not just any severe response, but something that's severe enough for you to carry an EpiPen on you because maybe you needed to be admitted to the hospital once for that allergic reaction. Maybe you needed significant treatment for an allergic reaction. And so if you have an EpiPen, if you carry an EpiPen because of a history of anaphylaxis, you may need a controlled setting for that immunization to be administered to you. It doesn't necessarily mean you can't get it, but just a little bit more watching around you when you get it. I think that's really the theme there. And if you're pregnant or otherwise immune compromised, right? So the guidance around pregnancy is this. You have to remember that for the most part, this vaccine was not studied in anyone who was pregnant. If they were pregnant, it was an incidental feature that happened after they got the vaccine and not something that they knew about at the time of vaccination. So there is almost no data on how a vaccine works and what its effect profile might be in pregnancy. But what you can do is take a lot of evidence and information from other vaccines. And what we know about other vaccines is where we once thought them to be sort of, oh gosh, you shouldn't give it to anybody who's pregnant. In fact, now over time, a lot of the evidence has shown that not only are those vaccines safe in pregnancy, but they're also highly effective. So where we used to say several years ago, if you're pregnant, don't get a flu shot. In fact, now it's recommended that you do, because we know that if you're pregnant, you can have more severe disease. And so the flu shot is thought to give you some additional protection from that. In terms of effects on the developing fetus, right, again, there's zero information, right? So you have to make this decision weighing some risks and benefits. But again, what we know about vaccines is that most of them are safe in pregnancy except for the live vaccines. And this is not a live vaccine, right? And we also know that over time, many of these vaccinations become recommended in pregnancy, like the flu shot, like tetanus, like pertussis, et cetera, right? So what I want you to think about if you're really struggling with this decision, especially because you work in long-term care or retirement homes, especially because you work in a setting where there may be where we know that there has been exposures, right? What you need to consider is what the risk is of delaying until after you've had a baby, right? And ultimately, it's a good idea to have that conversation with your healthcare provider and think through those risks together. Both decisions are perfectly reasonable. If you are pregnant and you decide, you know what, I would like to get the vaccine, after you consult with your healthcare provider, that is a reasonable decision. If you decide, no, I think I'm going to wait and postpone, that's also a very reasonable decision. What we're going to ask is that you've had that conversation and are making a decision that is informed by what you understand to be the risks. If you have immune compromise, so that's a very broad category, right? But primarily if you have any of those either conditions or are under treatment that would depress or dampen your existing immune system, we don't think the vaccine is going to cause further harm, but it's important that you know that it may be less effective. And so that doesn't mean you shouldn't get it, but it means you need to know that it may not be as effective at preventing disease as it might be in a person who does not have the same condition. So just think through that, but we don't think that there's anything that should stop you from getting that vaccine. Okay, so now I'm gonna jump into a bunch of questions that you asked us, okay? And so remember, we're gonna give you a copy of this or get you this information so that you don't have to write down everything. And also remember that sometimes this information changes, so it's just the best information that we have right now. How long does it protect us? We have no idea. This is a new vaccine, right? So we're going to need at least a few years before we know how long protection lasts. Some vaccines that we used to have, we used to think that they were, you needed boosters, and now we've discovered, no, you actually pretty much get lifetime protection from them. Other vaccines we've discovered, well, the immunity wanes over time and you do need a booster, and it's just going to depend. We're going to need time to sort that out. Does it stop transmission? So this is why I talked about earlier that we know that the COVID vaccine prevents the people who are vaccinated from getting severe symptomatic disease. Why is that important? Because the way that they studied it, they weren't routinely testing all of the people in the groups to see whether they got COVID, to see whether they got asymptomatic COVID. They were waiting for people to get symptoms, testing them to see if those symptoms were COVID, and then using that as the barometer for who got COVID. So what we don't know from those trials is if vaccinated or unvaccinated people got asymptomatic or undetected COVID because they weren't tested, either because they didn't have symptoms or didn't get tested, right? And so we cannot really yet, but we will be able to, as we roll the vaccines out to more and more and more people, we cannot really yet say anything concrete about whether the vaccine stops you from getting the disease and whether or not it stops you from passing it to other people. So why is that so important? That's so important because if you don't know that, and that's what we really think about vaccines, right? Is that if you get enough people immunized, it can stop the transmission. And if you don't really know that, then right now what we desperately need to focus on is protecting the people who might be at risk of severe disease, because we know that that's what the vaccine does, which primarily when we get down to it is going to be people over 70. And I'm going to show you that. I'm going to show you information about that. That doesn't mean we don't want other people to get vaccine. It just means we can't make any claims yet about whether or not the vaccine stops transmission. So you're going to see that even after a bunch of people are vaccinated, there's going to be still things that you have to do in your everyday work in terms of PPE and things like that. So this isn't going to be getting you out of that right away, but it's going to get us out of it slowly over time as we learn more about the vaccine. Can it be given to kids? Studies are underway right now, especially for the 12 to 16 population, I think, but there isn't enough information on vaccine safety and efficacy in those children, although what we know suggests that it would probably be safe and probably be effective, but there isn't enough data and it is not licensed or approved for those uses yet. And when will I be able to get it? So with you folks in this population, long-term care home and retirement home, staff, you are right in the first sort of basket of people who are going to get this vaccine. For the general population, the guidance is really like when we have enough, and as people become eligible for the vaccine based on provincial eligibility, we can start scheduling how people would get it. Okay. Side effects. So what are the long-term side effects of this vaccine? Remember that most vaccines do not have long-term side effects. We're not aware of any scientifically validated studies that say that vaccines have long-term side effects other than protection against the disease, right? So if you remember all of those studies about the theoretical connection between vaccines and autism, all of them have been debunked. They are not true. And most of those investigators either made up their data or inflated or otherwise exaggerated their data to make a point that they believed in, which is not appropriate, and it's not the way science is supposed to work. So most vaccines do not have any long-term side effects, and this vaccine is new, so we don't have data on long-term side effects, but if you extrapolate to what we know about other vaccines, you could guess that there probably won't be long-term side effects from this vaccine. Mostly it's going to be what you see in the short term, and then the protection that you get from the vaccine, and we don't know how long that lasts. Does it interact with medication? Most vaccines don't do that. So there are very few, if any, vaccines for which we cannot give them to you because you're on a specific medication. And this vaccine does not have any contraindications with respect to having, the medication profile of the person who's receiving the vaccine. Remember that many people in the trials that studied the vaccine actually had chronic diseases which would need medication. And so they were included in the population that was studied, and it was, and deemed to be safe and effective in that entire population. And also specific interaction studies have not been and probably will not be conducted. So you're probably not going to see studies that say, we're going to take a population that has this medication and study the vaccine in that population, because at a population level in terms of the large scale rollout, you think you want to be sure that it generally works, and then you can find exceptions later. But we don't think that there's any exceptions with respect to medication that people are taking. Can you get COVID-19 from the vaccine? No, absolutely you cannot. So the vaccine tells your body how to make a small part of the virus. Remember, it's just that little S spike protein. It tells your body how to make that virus so that your body can recognize the real thing later and protect you. So you cannot get the disease from the vaccine. You cannot get COVID-19 from the vaccine. And does it change your DNA? So the answer to that question is also no. The vaccine helps your body and your cells to make proteins that are shaped like parts of the virus, but that process itself does not really involve interacting with your DNA or changing your DNA. It happens outside of the place in your cell where the DNA is and relies on things that are unrelated to interactions with DNA. So there's no current thinking that the vaccine changes your DNA in any way at all. It does, however, use your body's mechanisms to produce proteins, just like you would produce your own proteins. It's asking your body to produce this spike protein. What if my immune system is already compromised? Sorry for the small text here. The vaccine was not specifically studied in people with severe immune compromise, but it was studied in people who have HIV, diabetes, and other conditions that may lower your immunity. So it's probably still effective, but again, maybe less effective than for those people without immune compromise. And we don't know how much less effective. So really the guidance is you should get it, even if you have a condition like HIV or diabetes that may impact your immune system. This may offer additional protection against COVID-19. Is the vaccine effective for the UK and South Africa COVID strains? Certainly, we think so right now. Early indications are that the vaccine does protect against those strains, again, because it's targeting that S protein, which if you change that S protein, the spike protein, too much, then it won't attach to your body cells as easily and then can become less infectious. If you change it a little, it can become more infectious, but then you still have the same basic structure that's being targeted by the vaccine. Can you get COVID after being vaccinated? So maybe, right? Like we do know that some people who were vaccinated got COVID in the trial. That's how you can determine the relative effectiveness. But it was far fewer people who got COVID after they were vaccinated than people who had no vaccine on board, right? So we know that the vaccine protects you very effectively against symptomatic disease, and what we're still waiting to understand is whether or not what would be the ability of the vaccine to prevent asymptomatic disease or the ability to have mild disease and pass it on to others after you get vaccinated. And will we need it every year? We don't know. We don't know how long immunity lasts, and so we'll need more experience with this vaccine to determine how often people would need it. Okay, so here's the deal on the local vaccine rollout, which vaccines, when, where. You're in phase 1, right? Phase 1 is broad, but you're in phase 1A of phase 1, the first part of phase 1, which is long-term care home residents and retirement home residents and staff and essential caregivers. And then there are going to be other priority populations that are determined by the province. They've already been determined, but remember the relative priorities fluctuate over time. And then phase 3 is going to be large-scale public immunizations, where we go out to the community and say, if you need a vaccine, you come to this place at this time. And we're going to have to schedule them, right? It can't be like the days where we would line everyone up for flu clinics, because we can't have people congregating or lining up. So we're going to need a scheduling kind of process to get those people in, rather than just everybody line up and get your vaccine process. Will I get to choose which vaccine I get? So the answer to that question is no. We don't get to choose the vaccines that we get from the province, so we can only offer you what we get. And if we have a number of different ones, the goal is to make the administration easier by grouping vaccines to communities of people. So we might be saying, all of you are getting Moderna, so that when we run back for your second dose, we know that that's Moderna. If we start mixing it up and saying you can have Moderna or Pfizer if you want it, then it makes it very challenging later when you come back for the second dose to say how many of each do we need to do that. So will I be forced to get the vaccine? No, there's no indication at this time that vaccines will be made mandatory, right? And in our history with all of the other vaccines, we've not really made any of them mandatory either. But a couple of things you should know, right? Will those discussions happen? They probably will. I don't know what the outcome of those discussions will be, but given the impact of COVID-19 on our communities and on our society, it's an important discussion that is going to happen. And remember, when that discussion happens, that the evidence supporting immunization, especially COVID immunization right now, is actually more certain and more complete and more rigorous than the evidence that we have on any other COVID-related measure, which includes masking, screening, testing, and every single other thing we do. The evidence supporting vaccination and its effectiveness is clear and certain and thorough compared to the evidence supporting the other things that we've been doing. So remember that as we enter into discussions around whether or not it should be mandatory. Safety. Okay, I'm going to try to roll through these things quickly because you're going to get this information and I want to make sure we have some time for your questions. How can it be safe if it was made so quickly? So one of the reasons it's made so quickly is that the scientists had the genetic sequence of this virus very early in the pandemic, which allowed us to develop tests for it, which is great, and which also allowed us to decide how does this virus look and what are the targets that we can identify for a potential vaccine. So we had the information early about how the virus looks. We also had some platforms that had been already developed, you know, when people were trying to find vaccines for SARS and MERS and those other things, that we could leverage as a scientific community to use those things and start from there. So they weren't starting from scratch, they were starting from some really interesting platforms that had already been developed. And it uses materials and processes that actually make it easier to make in less time than other vaccines. So a lot of the other vaccines that you use that actually require the virus itself, you have to grow the virus. Viruses are very, very hard to grow outside of people. You have to grow the virus and then have enough of it around that you can destroy it or deactivate it and then put it in vaccine. This vaccine manufacturing process does not require anybody to grow the virus, which is actually really helpful. It helps it to be made much more quickly. And was the approval process rigorous? So what we know about the approval process is that it was the same process. We don't believe that there are changes to that process in terms of expediting the vaccine approval. But what we understand is they accepted rolling submissions from the manufacturer. So normally what happens is you have to wait until all the trials are done, then you submit the results, then they pour over them with their experts, and then they approve. And they said, no, this is so important. As soon as you get data, send it to us so we can review it. And we understand that plus additional resources to Health Canada to help them, do the reviews expeditiously helped get this through. Is it safe if I have a health condition? So remember, the trials included lots of people with different health conditions. There are a few medical conditions that we've talked about that may need extra caution around your decision to get vaccinated, like a significant bleeding disorder just needs a bit of extra time afterwards. Previous anaphylaxis or a significant allergic reaction may mean you need vaccine in a controlled setting, or that you need a bit more observation time afterwards. What if I'm pregnant or breastfeeding? We talked about that, so I'm gonna keep going. Here's the thing that you really, really need to remember, and then we'll open it up for questions. I'll take the ones that I've started and then we'll go through them. COVID, we know, affects people of all ages, okay? So as of January 8th, this is the age distribution of COVID cases in Canada. And you can see that there are people from 0 to 19 in there. There are people from 40 to 49 in there. There are people from 80 plus in there. And in general, it seems like 70 to 80-year-olds have a slightly lower prevalence of disease there, right? So largely affecting people 20 to 49, right? That's probably the largest age group that's impacted by getting COVID. But now you need to look at this slide, which is the people who are dying from COVID. And this is the thing that we really, really need to keep in mind, especially where we cannot necessarily say yet that the vaccine interrupts transmission, but we can say confidently that it protects the people who are immunized, that the people who are dying from COVID largely belong to the age group of 80 plus and 70 to 79. So where the 80 plus category accounted for only 7% of cases, it accounts for over 70% of deaths. I don't need to tell you folks that, you know that. But why am I saying that this is so important? I'm saying it's really important because I believe that this is the priority for vaccination right now until we have better evidence around how effective the vaccine is at stopping transmission of disease. So what you need to know when this vaccine rolls out to your homes is that even from our perspective, the priority need to get immunized are your residents, because age is the most consistent risk factor for death. And then the priority afterwards in terms of the doses we have is giving it to staff and essential caregivers, right? Essential caregivers, many of them might also belong in that age group. So we would want to make sure that they get vaccinated as well. We will try to immunize as many people as we can, as fast as we can. Recognize that for some people, it is never going to be fast enough, and we will do we'll do as much as we can to get it done quickly, but we also want to make sure it's done safely. We also want to make sure it's done effectively, and also that as we do it, we're entering the data properly so that people understand how many people have been immunized and where we're going next and all of that stuff. But you can see, I think, from this graph how tremendously important vaccinating people over 70 in our community is, regardless of where they live. And that we're going to try to make sure that we keep that in mind as we go forward. So if at the end of the day, I think the purpose of this was to really help you to answer the question for yourself, whether or not you should get the vaccine. And it is absolutely your decision. It's a choice that you're going to need to make. I think the best advice I can offer you is that getting the vaccine is far better and far safer than getting COVID-19. You can help to protect yourself from severe disease. You may be protecting others at the same time, and I hope one day to be able to say you are protecting others. It's a good idea for most people to get the vaccine. We think it's very safe and effective for all age groups, really, where it's licensed, and for people with lots of different chronic conditions. But you'll have to make the decision that's right for you. I hope that this that this presentation has helped you to understand it. If it's a lot of information, again, you're going to have it so you can go back to it. If you have really specific questions about you probably want to talk to your healthcare provider who knows you and your medical history better. But most of them, I bet, would say, you should get it because the benefits of getting the vaccine outweigh the risks of getting the vaccine, as well as the risks of getting COVID-19. Just a reminder, I rounded up those numbers. If you actually look at the details, there'll be lots of decimals. I rounded them just to make it easy to present to you. None of this information should be considered as a replacement for specific medical advice about you. So if you need to have a decision that's sort of personal to you based on your personal history, you should talk to your healthcare provider about your medical history and the risks and benefits. And also what I used for the information, just to go back, is Government of Canada sources, as well as the product monographs for the vaccine, which are also publicly available. So you can find those on the Health Canada site if you want to go directly to the source of that information. But I hope I've encapsulated it for you in a way that helps you to think through it and to make a decision that's right for you. Once again, I just cannot say enough how much we appreciate you all. And you hear it from everyone, but this is really tough. And we will do everything we can to support you and also to get through this together, not just as retirement homes and long-term care homes, but as a whole community. So thank you very much.